What are the unique challenges of asthma-COPD overlap syndrome? Imagine trying to breathe through a straw while someone is gently squeezing it at the same time. That's similar to what people with asthma and chronic obstructive pulmonary disease combined experience. When both conditions happen together, it's called asthma-chronic obstructive pulmonary disease overlap syndrome, or ACO. This overlap creates some tricky problems that make diagnosis and treatment more complicated than dealing with just one of these conditions. Asthma usually causes reversible airway narrowing, meaning symptoms can come and go, often triggered by allergens or exercise. Chronic obstructive pulmonary disease, on the other hand, is mostly caused by long-term exposure to irritants like cigarette smoke and leads to permanent airflow limitation. When these two conditions combine, symptoms can be a confusing mix. For example, someone might have airflow that partially improves with medication, which is typical of asthma, but also shows signs of irreversible damage, common in COPD. This makes it harder to tell exactly what's going on. Diagnosing ACO is a big challenge because asthma and COPD can look very similar. Both can cause coughing, wheezing, shortness of breath, and mucus production. Doctors use lung function tests called spirometry to help, but results can be ambiguous. For example, if airflow improves a little after using a bronchodilator, it suggests asthma. But if airflow doesn't fully improve, it points more to COPD. Without a clear-cut test, doctors need to carefully review your medical history, symptoms, and test results to figure out if you have ACO. People with ACO often face more severe symptoms and a higher chance of sudden flare-ups called exacerbations. These episodes can land you in the emergency room more often and lead to faster decline in lung function. They might feel more tired and find daily activities harder. Because of this, ACO can significantly affect quality of life and overall health. Treating ACO is another challenge. Asthma usually responds well to inhaled corticosteroids to reduce inflammation and bronchodilators to open airways. COPD treatment often relies on bronchodilators, and inhaled corticosteroids are used selectively. But in ACO, it's not always clear which medications will work best. Some people respond well to inhaled corticosteroids, like those with asthma, but others might not. Doctors often need to personalize treatment, combining medications and closely monitoring how the lungs respond. Because ACO varies so much from person to person, ongoing care is essential. Adjusting medications based on symptoms, lung function tests, and other health issues helps manage the condition better. Sometimes newer therapies or additional medications are needed if standard treatments aren't enough. Research is still ongoing to understand ACO better. Scientists are working to find specific markers that can help diagnose it more accurately and develop targeted treatments. For now, the best approach is careful assessment, personalized treatment plans, and regular follow-up to keep symptoms in check. If you have asthma and notice your symptoms worsening, especially if you are older or have a history of smoking, it's important to talk with your healthcare provider about ACO. Getting the right diagnosis and treatment can help control symptoms, prevent flare-ups, and preserve your lung health. Staying informed, attending regular checkups, and communicating openly with your care team are key steps to managing this complex condition effectively.